Hello friends, I am Dr Sourabh Patwardhan from Nandadeep Eye Hospital PG Teaching Institute and FECO SICS Training Center, Sangli, Maharashtra, India. In our center, we have a lot of teaching activities which includes hands-on training as well. In this video, I'll be speaking about how to deal with VIP patients in your practice. Hello friends, I am Dr. Sourabh Patwardhan from Nandadeep Eye Hospital, Sangli, Maharashtra, India. And just now I finished a case on a VIP patient. By VIP I mean very important person. And as I finished the case, I thought that I will share the thought process which goes in our mind when we are dealing with these VIP patients. And by VIP, most often what we mean is the politicians or industrialists or people with certain influence in the society around you. But by VIP, I also mean our family members, our close friends who mean a lot in our personal lives, and we are in constant touch with them even before we join medicine. So these are also very important person for us. And when we are dealing with these VIP patients, though theoretically we always say that all patients are equal and we have to treat them equally, everybody knows that when we are dealing with a VIP patient, our thought process changes little bit and we are maybe more careful, or maybe we are always having two thoughts when considering a particular procedure or considering a particular technique. So I thought that I will just speak about it because this is not very commonly spoken. Now, dealing with a VIP patient is, I would say, a common thing for experienced surgeons practice, or a surgeon who has been there in the practice for a long time. So obviously you get more VIP patients day by day. But for a beginner surgeon, when he starts setting in or settling in his practice, the first VIP patient that comes to him or her is uh, poses certain, I would say, psychological challenges in front of the surgeon. And always the first VIP patient is a daunting task for any beginner surgeon. So let me tell you what needs to be done whenever such patient comes to your outpatient department for examination, or taking your opinion for a procedure. Make sure that you follow all your protocols. Many times it is seen that we miss steps in order to do things quickly, but if you miss steps and do not have particular information, there are chances that few mistakes may happen in the future. So make sure all the steps are followed while examining the patient and also while taking history. Also speak to the patient about their daily needs, just like as you speak with your other patients. So this VIP syndrome in OPD should be avoided in order to avoid any mistakes later on. Before surgery also, when for example you're thinking about a particular IOL for that patient, you should always think about whether I will advise this for his needs or not, and avoid taking up suddenly some new IOLs which have come in the market and you thought that that is the best for the patient. Always choose something which you believe or you have trust in, and also you have used previously, so you know that the outcomes are predictable and you have seen them. So that relieves a lot of pressure from your mind. If you advise something which you are not usually doing, it adds to the pressure. Now, before the surgery, make sure that the patient, even if he is VIP patient, he or she must understand the risk involved in any procedure. So, informed consent is very important before the surgery. As again I said, don't skip steps. The counselor must speak with the VIP patient as well. So you might be doing the counseling yourself, or sometimes counselors are there to help you with the counseling. So whatever protocols you are following, just follow the same, do the same counseling, explain the risk involved, and then only go ahead with the surgery. Because if you tend to skip telling them the risk involved, you may land up with trouble, or you unnecessarily take more pressure on you. Just for example, if you are going to implant, say, trifocal IOL, you must tell the patient that there will be a need of glasses in 5% patients, also the chance of glares, halos, etc. So if you don't tell that to the patient, considering that he is a VIP patient, how will he or she think about it? It may add pressure on you, and also patient may not be satisfied post-operatively. So make sure that all processes are followed. Now, when it comes to surgery, yes, it's though, as I said, for experienced surgeons, it becomes little easier because now he has done many hundreds, thousands of surgeries of similar kind. So you tend to kind of do the procedure without involving a lot of emotions. But for a beginner surgeons, it is a case where there is certain amount of anxiety which comes in your mind. At that point, you have to think very logically. So what I think about a particular procedure that I am going to do, if I have done, say, 1,000 procedures before that, and I have very successful outcome in 999 cases, that means I am going to be successful in this procedure as well, because there is hardly any chance of failure. But despite all this logic, sometimes the emotions take over, and we tend to be more anxious during the procedure. Always think of the procedure as stepwise. So don't think about the final outcome first. Go with stepwise. If you are focusing on that step, for example, incision, you focus on that. You focus on the CCC, then you focus on the next steps. So this avoids building of pressure. Certain things like maybe listening to music. I listen to prayers. Many people, they might be thinking of prayers or some song in their mind that distracts them little bit from the anxiety. But anxiety in the initial part of your career is very common, and nothing to be worried about. You will get over it soon. Suppose you get stuck in a particular step while operating on a VIP patient, and it happens sometime because your thoughts are not in line. Take a pause. This 5 to 10 seconds of brief pause helps you clear your mind and think logically how you are going to deal with this situation, because now you must have dealt with similar situations in the past as well, or you must have seen it how it is being dealt. So there is nothing to worry about. Just you know take back take a step back, just relax for 5 to 10 seconds, align your thoughts, and then go ahead, and most often you will find success in this approach. So dealing with a VIP patient adds certain amount of stress, and you have to also think whether you want to go ahead or you want to take up this case or not. And in certain situation where you might feel that you are not fully experienced enough about dealing with this particular case, for example, it's a post-polar cataract, or it's a very hard cataract, or maybe a subluxated cataract, and patient, I may not be able to do a successful surgery in that particular case. There is no harm in taking help of a senior colleague to do the surgery, or maybe refer the patient to a surgeon who can deal with it more comfortably. And as you go on in your practice, as you gather experience, you will find that your confidence is building, and you can then later take up these cases. So these are my thoughts, but as you know that every surgeon thinks differently, and may approach the same situation differently. I would like to invite comments from my colleagues how they deal with this particular situation, as they went into practice and dealt with them successfully. What are the key points they would like to make? For more such videos, of course, do subscribe to my YouTube channel. Thank you.